Welcome everyone to the RFS Tackle Mental Health Podcast. This is a podcast that is hosted by RFS Behavioral Health, Northwest Ohio's largest school-based mental health provider. We specialize in school-based behavioral health services, and this podcast is all about highlighting mental wellness and mental health with a specific emphasis on our youth. For this episode, we have two incredible clinicians, Alex Carter and Cecil Holsten. Not only do they have years of experience with mental health and practicing in the field, but they also manage teams of incredible clinicians. Today we are talking about the state of mental health, where it's going, and what we can do now to drive impact for our youth. Welcoming Cecil and Alex, let's get into our first episode. If you want to follow us outside of the podcast, visit our website at rfsTackle.com or follow us on Instagram, YouTube, and Facebook by searching RFS Tackle. Let's get into it.
I'm a licensed master social worker, and I've been in the field a little over 8 years now.
I'm Cecil Holsten. I'm a therapist, licensed master social worker as well. Been in the field for 13 years.
Awesome. And so before we get started into the questions, what made you guys want to enter the social services field?
So for me, it definitely stems from my upbringing. I come from a family that would not hesitate to lend you an ear or a hand. And so I saw those different skills modeled at an early age. And my grandmother was very much like a heroine to me, like a superhero to a certain degree. And I wanted to emulate that and be like that because it was a rarity in my community. And so that's ultimately what prompted me to get into this field and the helping field. And then as I learned the skills and became more immersed in the culture, mental health was the path that eventually ended up being where I was going to end up at as far as the helping field was concerned. So for me, it was definitely my upbringing and my foundation.
I'd say very similar. Grew up in a single parent household. So my mom and my grandma were my two road dogs who helped me and molded me. So for them to be able to be the helping ear, that phone, my grandma's phone wouldn't stop ringing. My mom's phone wouldn't stop ringing as a kid. So my mom and my grandma definitely was what made me want to be a social worker because they were social workers.
Right. Just not licensed.
Not licensed, right?
Yeah, we got so many of those. Awesome. So today we are here to talk about the state of mental health as it is in 2022 going into 2023. Both of you have lots of experience in the field, so let's talk about what it was when you started and what it is now. So, does anybody want to start first?
Yeah, absolutely. So what I see now is this trend towards being more distracted, more impulsive, more depressed, more addicted, and it's happening at a very, very high rate. And I would venture to say that they're partaking in much more riskier behaviors because of some of those symptoms I mentioned before. And I believe a lot of it has to do with this idea of instant gratification and what they're getting or not getting, lack thereof, in the home. And it's sort of like this idea of their needs not being met and this love and acceptance. You think about Maslow's hierarchy of needs. When you talk about basic needs, food and shelter and clothing, and then you move up to safety and security. And then that third tier is actually where you're at love and a sense of belonging and acceptance. And I see this trend to where they're no longer just concerned about that first tier of just their basic needs being met. The priority has very much so become that sense of belonging and acceptance. And they're willing to sacrifice those other two just to experience that, whether it is productive and conducive for them or not.
I think for me, early on in the field, mental health wasn't talked about, honestly, right? I think it was something that was taboo. I think it's still kind of taboo in a sense, but this generation is more open to talking about it, right? They're more talking about the anxieties, the depressions. I think you can scroll on any social media and see someone talking about mental health. And you can kind of see it in a way where it's they're open about, oh, I'm depressed or oh, I'm isolating. I think COVID tremendously affected children because for 2 years we told them they could not be around people. We told them they could not socially talk to anybody, don't be 6 feet next to anyone, and then we put them back into their environments and said, be normal. right? And no one gave them the tools to be normal for 2 years. So now I think we're seeing a lot of kids who are anxious, who are depressed, who had to live in their traumas, right? They were forced to. And so now we're seeing almost adult-like children dealing with adult-like problems. And them sometimes they don't know how to process. Adults don't know how to process adult situations, right?
Mm-hmm.
So we're expecting 14 and 12-year-olds to understand how to process adult-like things, and they can't. And so I think now mental health is more talked about, so it allows that opportunity to talk about it openly, and you can talk to your friends about it. But I still think we're like light years away from actually understanding mental health.
Yeah, absolutely. Yeah. So on topic of that, what are some things that people can do to kind of shift that culture? Is it limiting social media, or is social media just something we have to deal with now?
Yeah, so I think that it is something that can be used for good. And as Cecil was pointing out, years ago, there weren't people using these giant platforms that they have on social media to promote mental health awareness. Athletes, celebrities, people with a huge following coming forward and being transparent about their own issues and mental health, which I think is a great thing. But, like Cecil said, we still have a long way to go. But I believe that using those things for good and recognizing those platforms and some of those individuals being transparent and just us amongst each other, humanizing ourselves and stopping to check in and be like, how are you doing? But like, no, really, how are you doing? You know what I mean? I think we've moved so far so fast in this like microwave society to where we don't stop and take the time to really check on each other. Mm-hmm. And the mental health has slowly become a non-priority or something that isn't focused on, or just like, it isn't checked on as much as it was. So I think that social media, it does have the ability and the capacity to impact people in a negative way when you talk about fitting in and stereotypes and measuring yourself towards someone else's success. I think there is room for some of that, but there also, on the other side, is some ways that it can be used to benefit people from a mental health perspective.
I just made a post that said social media is a gift and a curse. Yeah. Right. I think social media has a great opportunity to teach, educate, but you have to make sure you have the right people educating. You have to make sure that you're not telling people information that's misinformation. Yeah. You have to make sure that person is actually a licensed professional, right? You don't want your teenage 16-year-old friend telling you about depression and anxiety, because that's what they're going through. Because we know anxiety and depression doesn't fit the mold for everybody, right? It doesn't look the same for every single person. So I think social media is a great tool. I think the internet is a great tool, but you also have to sit in front of a licensed professional. And you have to let that information come from them, because listening to your mom or your grandma tell you about what they went through, it's not the same as what you're going through. Yeah. So I would say social media can be the gift and the curse in that sense.
That's good.
Oh yeah, I love what you said, because also too, I think so many times we're an open culture, but we're not necessarily solution focused. Mm-hmm. So that's where that danger of like, we're all just blurting out our bullshit, but we're not constructively talking about how to make it better. Mm-hmm. Yeah. And that's where it gets dangerous, and that need for a licensed professional really is so extremely important.
Yes.
100%.
Okay, so let's get to the first question here. More than 2.7 million youth are experiencing severe major depression. What could be the cause of that? Kind of already touched on it a little bit. So, yeah. But if you have more, that would be awesome.
Okay. Mm-hmm. So those are staggering numbers, and I would venture to say that it's just scratching the surface. And the reason I say that is because we see depression is really at the core of a lot of anger, a lot of frustration, a lot of anxiety, right? And so a lot of times, not necessarily misdiagnosed, but if we really dig deeper and start to peel back the layers, the very root emotion or the mental health disorder that we're seeing is depression, but it manifests itself as anger or defiance. So that's the first thing that we're trying to put a Band-Aid on, when really there's something deeper going on. So I'll say that statistically speaking, it's probably higher. But in terms of causes, you see a few different things. It could be nature, and in terms of genetic predispositions, right, to mental health, much like an individual can have a genetic predisposition to high blood pressure or heart issues, right? You can have that from a mental health perspective. If parents, had a mood disorder or struggle with some sort of mental health disorder, then statistically speaking, their offspring could, also have that disorder as well. And then you also have nurture, so the environment that they're raised in. So if they are raised in an environment that is not conducive to their upbringing and supportive of their mental health, to where their self-esteem isn't being prioritized or there's neglect, from that nurturing perspective, you can see depression start to take root. And then also, as a young person matriculates, hormones are going to play a factor. So when we get into those preteen, those teenage years, emotions are flying around, they're all over the place. So a lot of times, that can lead to changes in their mental health and manifest as depression as well.
I think the biggest thing I'm going to say is the whole Twitch situation, right? Where we saw someone who was put in the front for everybody, right? He had to smile, he had to dance, but he was battling challenges. We can do the Robin Williams. We can do so many, the Mac Millers, right?
Yeah.
Where people were feeding others, right? We're feeding others, and we're literally they're suffering. We call it suffering in silence, right? And depression it's you, right? You have to sit with you, and you don't like it, right? Where you have to deal with what's going on with your environment, the stressors, the challenges of life, and it's just hard. It's overwhelming. And so I believe a lot of times people isolate, right? And that increases the depression, right? Or you start to remove yourself from friends, and you're like, why, right? The why of myself. And so I think a lot of times for depression, it's the focus on you, right? You got to focus on the thoughts in your head. You got to focus on the environment you're in. You got to focus on the traumas you may have experienced. And now you're like, why me?
Yeah.
Right? Why me out of everybody else? And the thing I'll say about depression for the most part is if you have someone, or if you're feeling depressed, talk to someone.
Yeah.
Right? Reach out. We got to stop saying like check on our strong friends, because the strong friends will always put a facade up. Right? I'm okay. I'm fine. Nothing's going on. It's not that serious. But just sit with sometimes. You need to sit with people. Or just pull up to the house and sit with them. So I think that would be for me what I would think the cause of depression is. You got to focus on you, and it's hard sometimes to get out of that. Like, why me?
For sure. I love what you said about the strong friend, because I feel often like I'm the strong friend, or I also have strong friends, and like, how are you? I'm good. I'm cool. I'll figure it out.
Yeah.
So I know you said just like sitting with them, spending time with them. Is that the way you do check on your strong friends? Is there any other ways?
I would say like you can ask them if they need to, like do you need me to listen to you, right? Do you need some coffee, or bringing coffee and tea over, right? Or sitting with them and asking them like, hey, I watched your favorite movie with you, right? Or maybe we just go for a walk somewhere. Getting them, sometimes when you're in a depressed state, you want in your comfort zone, right? My house, my room, my clothes that I wore for 3-4 days straight, my organized chaos pile over there, right? Maybe you go over there and you just clean the house, right? Maybe you go every weekend and ask them like, hey, you just need to sit with me for an hour, all right? I got an hour of my time. I'm gonna carve it out for you. I'm gonna sit with you. I know 60 minutes sounds like a lot of time, but in reality, that can mean the most to somebody. Or simple like, I appreciate you, I love you, I'm here for you. It takes 3 seconds to send a text message. So sometimes just those meaningful messages, or I'm just checking in on you. I left something at your door, right? We DoorDash so much, why can't we be DoorDash, right?
Yeah.
So sometimes those can be the other things to check in on those depressed friends.
No, that's so good, because I believe that those small acts can really go a long way. And a lot of times those strong friends don't have someone that they are to other people. You know what I'm saying? Because they're always the ones checking on other people, or doing things, or going out of their way to meet someone else's needs. So the reverse doesn't happen to them a lot. And the households that they come from, the expectation is always so high that there's no other way out. Like, that's just always the requirement. And it's never like, failure is not an option. Exactly. And so that pressure is always on them. And so if you're able to get out of your comfort zone and go check on that one who's always checking on you or other people, it would really go a long way. That's good.
Incredible insight. I love it. So for over 1.5 million youth in the U.S., are basically using drugs and alcohol or have an addiction already. How can we reduce those numbers? But I think before we answer that, let's talk about why youth have such access to drugs and alcohol and why they're automatically reaching for it.
I always use the analogy, right? A lot of these kids are using breeze pens or whatever. But I always say our parents smoke cigarettes, right? And that's how they decrease their anxiety. And so we have so many kids who are anxious and depressed that they're trying to decrease it with usage, right? Or I don't want to feel, or I don't want to think. And so it allows them to remove themselves from that.
Mm-hmm.
A lot of the kids I talk to about substance use, they're always like, I don't want to feel. I don't want to think. I don't like those feelings. So then I come back and reframe it and say, well, what happens after you're not high anymore, right? What happens is it's like a Band-Aid over a humongous wound, right? The wound's still there. You're just Band-Aiding it.
Yeah.
And so they're always like, So I'm like, you're temporarily helping yourself, but you're temporarily still stuck with those feelings and thoughts, right? They're still not going anywhere. And so I think kids are just the music. Everybody, it's openly talked about so openly, especially the ones we talk about, like the Juice WRLDs and the XXS's, right? They talked about it so normally that now kids are like, well, I'll try it, right? Maybe I'll try it and it'll help me. Or my friend used it and it helped them. And I'm like, that's not always the answer to your problems or your stressors. So I think kids just now, it's a way to remove themselves from reality.
Mm-hmm. Absolutely. Yeah, I couldn't agree more. And a lot of times we see alcohol and drug abuse coincide or it's a co-occurring disorder with some other mental health disorder. So they're basically self-medicating. And you think about, going back to Maslow's hierarchy of needs and the sense of need and acceptance and love and belonging, if they don't have that in their immediate environment, they're more prone to partake in riskier behaviors, right? Some of those riskier behaviors may include drugs or alcohol because it's trying something new, it's trying something different. It's an escape from the reality, even if it is temporary. It's a way to fit in, right? Or get along with a certain group or a crowd when everything else doesn't seem to be working. So that's certainly what we see a whole lot of when it comes to the substance abuse.
And how do we reduce it?
I think education, right? I think not saying like don't do it, because we know once we say don't do it, you're gonna walk out and still do it, right? So I think it's just the education of understanding how it can affect you, right? Like this is what this does, this is what this can do. Your brain's still developing until about 25, 26, right? Those kind of conversations are helping kids understand like your now can affect your later. Right, and it's like the candy now and later, right? Like now you are temporarily fixing something, but later it may be a lot different. So giving them that kind of education, being transparent with them, like, hey, I get it, I understand, but let's try this instead, right? Maybe let's try a walk every time you feel like that. Maybe let's try watching your favorite movie. Maybe find a blanket and take a quick 15-minute, 30-minute power nap, right? Take a cold shower. Those type of like coping mechanisms to help kids understand like smoking, drinking doesn't always have to be what you fill the void with.
Yeah. No, absolutely. Everything you said was spot on. I agree with it. It can't be a punitive approach. It can't be wagging your finger, telling them that, this is wrong and condemning them for the choices that they're making around drugs and alcohol. It's got to come from a standpoint of you can create better for yourself. You are the master of your destiny if you choose to be that. And the path that you're heading down, this is what it could lead to education-wise. But it doesn't have to be that if you don't want it to be. And I think also encouraging them to kind of be their own person, separate themselves, because we see a lot of followers and not enough leaders, people willing to go the path of least resistance or kind of walk their own path out. It's always kind of following the masses or what's popular in music and movies and in social media. And I think so far gone are the days where people are willing to kind of go against the grain, be a counterculture within their culture, and do things a different way. So encouraging them in that regard too, I think is beneficial.
Love it. About 60% of our youth has major depression, and about 60% of youth with major depression do not receive mental health treatment. What do you say to those who are maybe intimidated or scared to get treatment?
Yeah, I always say when it comes to treatment, like you get to create what you want to create during treatment, right? It's about you, right? It's the first time probably your first time in your life you get to actually talk about self. No one judges you, right? No one tells you what to do. You create your goal. right? You create the goal that you want to work on. And if you want to change it in 3 months, we change it in 3 months, right? If you decide that the person you're working with is not the person you want to work with, ask for someone different. I think we have to start talking about treatment like you talk about your doctor or your dentist, right? You go to the dentist and you're like, nope, didn't like the dentist. Let me get some recommendations for one I like.
Yeah.
I think you should treat your therapist, your case manager the same exact way, right? If I'm like, we're not really clicking, I'm not meshing with this particular person. Let me try somebody different. And be willing to try that. And be open-minded when you come to treatment, because if you're closed-minded, it's not going to work, right? It's just not going to be something that you enjoy. It's going to feel forced.
Yeah.
So you want to make sure when you start treatment, don't do it because someone told you to do it. Do it because you're ready.
Yeah. That's so good. I think putting the onus on that individual, giving them that agency and that freedom to choose what their treatment will look like, right? And then also it is trying to identify what actually is the barrier. Is it really intimidation? Is it fear of acceptance? Is it fear of rejection? Is it vulnerability? Is it shame? Like, what is that emotion, that core emotion that's keeping you from taking that step and seeking the appropriate counsel or treatment? Because you can't defend what you can't define, right? And if you can't define what you're dealing with and what is the barrier, then it's hard to defend that or get around it or go through it. So I think that's a good starting point. And then understanding whatever that fear is and encouraging those people that, hey, look, on the other side of whatever it is, that barrier, there is freedom, right? Once you decide to take that step and, receive that treatment from a licensed professional, there is freedom and a path towards healing. And so I just want to encourage anyone who's experiencing that's a reality.
It's so funny that you guys say this, because I am on my 4th therapist now in my lifetime since I've been 18. And with this therapist, I absolutely love her, and we've built a really great relationship. And I noticed that it had everything to do with me. Because my first 3 therapists, I was lying. I was not being truthful. I don't know. And with this last one, I said, like, I'm going to be me. And I am going to be as transparent as I possibly can. Because why am I afraid of being judged? She gets paid for not doing it.
Exactly.
And I mean, it's been very fruitful in terms of like healing. So.
Absolutely. Yeah.
That's awesome. Okay. What do you think needs to be done to make a positive change? Did we already talk about that?
I don't think so.
Okay. Yeah. What do you think needs to be done to make a positive change with mental health and our youth specifically?
So I'll say this, and we hear it a lot. It really starts at home. It starts with parents. It starts with families. First, being well themselves, right? Because you can't help someone work through something that you yourself aren't at least on the path of healing or on a journey of taking the steps to do through. But also, kids and children and teens, they're going to do what we do, not what we say, right? So even if we get the education as parents, as leaders in the community, but we're not practicing the right things, like within the household, obviously they're not going to gravitate towards it. They're going to see it. It's BS. They're going to call it out. They're going to call it for what it is. So I think in the home, we got to make sure we're practicing what we preach, so to speak, right? So if we're telling them they got to practice their coping skills and they got to handle these conversations in the right way, we can't be cussing our spouse or whoever up and down, sideways, smoking, drinking, and dealing with our stress, anxiety, depression in an unhealthy way, and then tell them that they can't, do the same thing, essentially. So we got to practice it. We got to educate ourselves as parents. And then also, too, beyond that, once you have that established within your home, also partner with other parents that are kind of trying to do that same thing. Because I think that's when neighborhoods are created, communities are created that are all kind of pulling the rope in the same direction or on this path towards healing and towards prioritizing mental health for their children. And then you have generations in a neighborhood and then communities. And then I think that's a good strategy to let that spread.
I think the biggest thing is there's a generational disconnect with mental health, right? I think the generations before the millennials, before the 80s, were told to just deal with it, right? You can figure it out. You got to sit with your own stuff.
Yeah.
And so now we're telling this generation's like, I don't want to sit with my own stuff. And they're like, well, why? I had to. And so we're constantly in this battle of like, I had to, but I don't want to. And so I think, like Alice was saying, educating parents first, like mental health 101, right? This is what mental health is. This is what it's about. It's what a coping skill is about. It's what a calming skill is about. It's what mindfulness is, right? Because I think this generation understands it, but the generations before don't. Because they're like, I had to sit with my own stuff, right? My parents told me to, right? The baby boomers, even before that, the Great Depression, right? Where the great-great-parents are like, we got to figure it out, right? We went through a bunch of stuff. And so we had to sit with it. And so you can sit with it too. And so I think now the youth are like, we don't want to sit with it. We need help. We want help. And then parents are kind of like, no, they don't. They're good. Go wash a dish, right? That'll help you, right? Go watch your kid. Go watch your brother and sister. You'll be okay. And I know as I chuckle, that's a defense mechanism, right? But in reality, that's some of the conversations being had.
That's what we're dealing with.
So I think educating parents, and then once you educate parents, like I was saying, educate the community. It takes a village. Right, to raise a child, so it takes a village to help understand mental health as well.
Yeah, absolutely. What can those without insurance do to help their mental wellness?
That's good. So I would say first, maybe explore different options in terms of getting the insurance that would allow you to, get that treatment that you need. But if we're talking about things that you can do that are just, free, essentially, there's a lot of resources. There's a lot of content. Again, we talk about the internet and our technological advances in society. It's given us some good things that we can use to tap into different resources online. So, I always talk about, first, you got to figure out, you got to do a self-inventory, like what's going on with yourself. So you got to be able to sit and figure out what is really going on. Cut out all the noise, the distractions, turn off the TV, stop scrolling, and sit with yourself and your emotions. And just for 30 seconds, especially in this day and age, people get very comfortable or uncomfortable, I should say, in silence, right? They have a hard time doing it. And so I think that's a good place to start, so you can figure out, okay, what exactly am I dealing with? And then if you want to put pen to paper, start writing some things out. I mean, that's always something that you can do to put kind of ink to whatever you're experiencing, as well as, working through your thoughts. And I always offer exercise. I mean, it is something that is so valuable and so research backed, and there's so much evidence to the benefits if you're able to go out and exercise, how it improves your mental health and your quality of life. And it isn't something that you got to spend, money at a gym membership. Again, you can YouTube exercises at home, and you could get, a workout in or go take a walk. And just even that bit alone would be able to help you in a healthy way.
Along with some of the things that Alex is saying, I know your local mental health and recovery services board sometimes has the opportunity to give pro bono to certain local community mental health agencies. I know there are some therapists that do pro bono, right? So I always say, if you don't ask, the worst answer is no, right? So there are therapists who are willing to take on clients for free for a little while, maybe 3 to 5 sessions or whatever you can afford. I do know certain community mental health agencies do have opportunity to do no insurance. But it's just, you just gotta, I was just saying, you gotta ask, right? And I know sometimes when you're in that phase, you don't, because you're like, I want help and I expect help.
Yeah.
But sometimes you just gotta be like, hey, let me check in with this. Let me call 211 and see if they can help me.
Yeah.
So there are some opportunities. You just gotta look for them. I know there may not be a lot resource-wise when it comes to having no insurance, but those are just some ways to start. And then also, like Alex was saying, with coping skills, exercise, sitting with yourself, journaling, taking a walk. If it's pacing up and down the stairs, right? If it's walking in front of your house, back and forth, getting your body moving sometimes kind of helps. Not just laying around, or if it's, like I said, walking to the refrigerator, walking back, pacing back and forth. Just get your body moving for that 10 or 15 minutes.
All the things that sound so cliche, but like you say, it's not cliche, it's evidence-based.
It is.
That's why we're talking about it, because it works.
Absolutely.
Yeah. I think we're going to be running in our... Just get another one going. Perfect. Okay. What are valuable resources that students can access for their mental health?
RFS Behavioral Health. Our T.A.C.K.L.E program, school-based services are ready and willing, and have a lot of great, passionate clinicians there housed in the schools to help you. And then, beyond that, there's a lot in the community. And then even at the state level, the Ohio Department of Education and the Ohio Department of Mental Health and Addiction Services has a website that has great information, not only for teens and adolescents, but also for parents and caregivers as well, that maybe experience it themselves or have a child that's going through it. So all great websites, all free to access, and resources to help anyone experiencing a mental health issue.
I'll just run back what Alex said. RFS Behavioral Health. T.A.C.K.L.E.
Shameless plug.
Shameless plug. But there's other therapists in the city. There's psychologists, psychiatrists. Psychiatrists are if you want medication. Psychologists and therapists if you just simply want therapy. Or if it's psychiatrist is therapy and medication. So there are resources. There's local community mental health agencies. There's the Mental Health and Recovery Services Board at the local level. So there are resources that teens can tap into.
Quick Google search, right?
Quick Google
That's
search.
it.
And
Yeah.
I believe there is a 988 hotline now for
Yes.
suicide.
Yes,
So you
there
don't
is.
have to call anymore that long number.
Mhm.
Just send a text out. So if anybody's experiencing any suicidal ideations or want to harm themselves of any sort, 988 is a good hotline as well.
Awesome. So just to wrap this up, what is the state of mental health in our youth today?
I would say we are in a spot of kids are asking for help, but the system is overworked right now. It's like at capacity. And not in a sense of like, there's just not enough social workers for therapists for people. And kids are asking, like, I mean, it's not like they're not. I just think right now, people weren't ready for the pandemic 2 years later, right? Or a year later. I'm thinking too, it's like we're a year removed. I don't think people really realize how damaging that cost socially, emotionally, mentally, for children, especially developmental wise. And I think we're seeing the effects of COVID, the after effects of that social isolation, especially for development for kids. 2 years removed from being social can do damage. And even as adults, I think we just worked through it, right? We just kept working. We haven't stopped.
Yeah.
So we haven't even seen it for ourselves. Kids got a chance to kind of just stop and slow down. But I think we've just kind of just overworked. And I think for kids, they just had to sit with it.
Yeah, absolutely. I think we're in a pretty good place, or a place that's trending, because mental health awareness is increasing, and schools and communities are getting on board with trying to do whatever they can to support our youth when it comes to mental health. But again, the work is plenty, but the workers are few. I mean, there just isn't enough people that are willing to get the education, be licensed, and have a passion to go do this work, because it isn't easy. It's very thankless, very much so, and it's got to be the right person, to have that heart to go and do it. So I will say that there are individuals and teens that are asking for the help, that need it, and are seeking treatment. And we just got to rise up to the occasion and meet their needs. And I think this is where we break the generational cycle of this mental health issue and the generations of trauma without treatment. All these untreated mental health issues and disorders that we just white knuckled through the 70s and the 80s and so on and so forth. We got to be able to open our hands and be willing to do the work at this point.
Absolutely. Mm-hmm. What are the changes you want to see in regards to the state of our mental health for our youth? And how do we make those?
I would say accessibility to services. I mean, just any way we can streamline that. And I think we're doing a good job of it. And just taking advantage of the technology that we have and using it for good. And also, too, parents willing to do that work and kind of get out of the norm that they were used to when they were growing up, as Cecil mentioned, how they dealt with mental health, because they didn't, So that it'll take them, the buck stopping with them and saying, hey, look, it's got to stop with me, because it's got to start with my children. So I have to be willing to do the work as a parent, as a caregiver, practice the right things, educate myself with the right information, so that can be modeled for, my children, and then so on and so forth.
I think for youth, allowing them an opportunity to talk about their stuff, right? Where people are just simply listening. I think we always want to give solutions to teenagers and tell them what they should be doing. But sometimes just listening sometimes is like the greatest thing. Like Alex said earlier, silence is golden, right? And when you're listening, you're actually in silence, because you're just simply listening to that person. You're not judging them. You're not giving them like, oh, well, you should try this or you should do this. It's just like, tell me where you're at, right? Give me where you're at right now so I can just listen to you. And I think that's what we need to get back to, is just like allowing teens, youth to just talk, right? You have an opportunity, you have a platform to be yourself, and we're just here to listen to you. We're adults, but we just want to listen.
Yeah,
that's so good.
Not dismissing them because, like you said, at the end of the day, they're children, yes, but they're dealing with adult traumas. They're dealing with adult problems just like adults are, and they have thoughts and feelings and emotions surrounding those things too. So just because they're kids doesn't mean that it's invalid.
Exactly.
100%.
Exactly.
And that listening, that is such an underrated tool and skill, you know? Because if you think about the things that you're holding on to, that, you know, whether it's fear or vulnerability, it's strange, but like once you give voice to it, it like immediately starts to loosen its hold and power on you, right? Like, so just that in and of itself, having someone that has just this genuine, unconditional, positive regard that'll just sit through whatever stuff you're dealing with and listen to you, it probably doesn't happen often for our teens. And so that's super helpful if we're able to do more of that.
I always say vulnerability is not about the other person, it's about you, right? Because a lot of times we don't like to be vulnerable because we're in fear of what the response is going to be. But really, in reality, the response is what you need to just talk that stuff out. So if you can just talk it out and someone listens to you, it'll change. It's like life-changing sometimes.